Have you been told that you have a meniscus tear either by a doctor that ordered an MRI scan for you? Maybe you're just having some knee pain for a while and you're starting to think that maybe this is a meniscus tear and you're not quite sure what to do. And perhaps you've got some questions about the tear, like can a meniscus tear heal on its own, or do all meniscus tears need surgery? How do I know if my meniscus is torn? Is walking bad if I have a meniscus tear? I'm Dr. Brad Homan, board certified orthopedic surgeon. I have over 20 years in practice. I have treated thousands of patients with knee problems, and I will answer all of your questions about meniscus tears, how you know you have one, and what you're supposed to do about it. First, we'll start off with an anatomy lesson, just kind of talk about what a meniscus is. I'm going to use this plastic knee here to kind of demonstrate what we're talking about. There are two meniscus inside the knee. There's one on the inside of the knee, that's called the medial meniscus, and then there's one on the outside of the knee called the lateral meniscus. And so what we're talking about, if we open up the knee joint here, these rubbery cartilages in between the two bones, the femur and the tibia. They're like these C-shaped cartilages. They actually appear to be rubbery in consistency, and they're basically like shock absorbers in the knee joint. So not only do they provide shock absorption, but they also give stability because the femurs articulate sort of in the middle of these meniscus. They keep the joint stable. And in addition to that, they help protect the joint, distribute the fluid in the knee joint to help kind of preserve your articular cartilage or the cartilage that's on the ends of the bones. And so one thing that's notable and important for knowing how to treat meniscus tears is understanding the blood flow pattern. And that means where is the good blood flow in the meniscus? And the reason that that's important is that the blood flow is how we heal. And the meniscus has very good blood flow along the outside, like what we call the periphery, and then the blood vessels will go from the outside and then work their way to the inside of the knee joint, where inside in the very middle they don't have good blood flow, whereas on the outside they've got very good blood flow. And the reason that that's important again is that some meniscus tears, if they're located in the areas where the blood flow is very good, those you can expect to potentially heal without surgery, or if you do end up having a surgical procedure for repair, those are going to be the tears that will do well with a repair. How do meniscus tears happen? There are actually two main types of meniscus tears, and the first one is going to be what we call a traumatic meniscus tear. So this is a meniscus it's very robust, it's good tissue, and you just happen to twist your knee in the correct way so that the femur and the tibia bone just kind of like grab that meniscus and rips it. And so that kind of a tear is what we would consider traumatic tear in normal meniscus. The other kind of tear that we see often is what we call a degenerative meniscus tear. And this is more age-related kind of degeneration of the meniscus. It becomes a lot less robust. The tissue becomes more friable and it's easy to get injured. And so with very minimal trauma, the meniscus can tear. Degenerative tears are also associated with bad arthritis. And you have the cartilage is wearing down in the joint. You've got a lot of inflammation in the joint. The meniscus tissue also becomes affected by that, becomes much less robust, much easier to tear, and those degenerative meniscus tears don't necessarily have to be related to any specific injury or trauma. And then you've got those tears that are kind of in the middle of both of those. So they're slightly degenerative, but there was an injury that caused the main tear, and then it becomes symptomatic. And so the different kinds of patterns of meniscus tears can also be important because that depends on whether or not this could be a surgical problem and whether or not this may be something that could possibly heal on its own. And so one of the types of tears is like a flap. So if the meniscus tears and just a piece is flipping around in there, that's never really great because that can cause what we call mechanical symptoms. That can cause joint locking and catching and popping, and those flaps can get caught between the tibia and the femur when the knee is doing a twisting motion, or especially with deep knee bending. Sometimes the meniscus can completely split in half, and those potentially can be symptomatic, but some of those can be stable, and if the tear is located in the area where the blood flow is good, then those tears may potentially heal up fine non-surgically. And then the worst kind of tear is what we call a bucket handle meniscus tear, and that is a tear that goes from the back of the meniscus all the way around to the front, and basically the inside of the meniscus sort of flips over and ends up in the middle of the knee. And that's the worst kind of meniscus tear because that one is always going to be symptomatic. It's either going to lock your knee up or it's going to inhibit your ability to fully straighten the knee because that meniscus tissue is kind of caught between the two bones. It's important to keep in mind also that not all meniscus tears are painful. Smaller meniscus tears, degenerative type meniscus tears, a lot of those meniscus tears don't even cause symptoms, especially if you're not very active in athletics or if you're not putting your knee through a lot of impact or twisting motions, then a lot of times you won't even notice that you have a meniscus tear. Common symptoms of a meniscus tear. How do you know that you might have a meniscus tear? And this can be either very mild depending on the size of the tear, or it could end up being pretty significant. And like I'd mentioned, if you have a smaller tear or if it's a split tear that's in a good spot, then you may not necessarily feel any symptoms at all. Typically what you'll feel is if you have your knee bent a lot and you're twisting, then you'll feel a sharp pain on either the inside or the outside of your knee, depending on where that tear is located. If it's a more significant tear, if there's like a flap or that bucket handle tear, then your knee is definitely going to be experiencing some popping, some locking, potentially catching, swelling, pain. And again, usually depending on the side of the tear, you're going to have your discomfort either on the inside or the outside part of the knee. So what do we do for a meniscus tear? And treatment number one is non-surgical. If you have a tear and it's a smaller tear, not necessarily that symptomatic, or if you just started getting symptoms, then the first thing to do is activity modification. The injury can be made worse with a lot of impact, like running or jumping, deep knee bending, twisting. Like those are the motions that are going to aggravate a meniscus tear for a short period of time. At least you want to avoid that kind of thing so you're not increasing the inflammation and you're potentially giving the meniscus a break so that it can heal if it's going to do so. Exercise and strengthening is another important thing. Not doing the impact, not doing the twisting or the deep knee bending, but it is important to do an exercise program because the muscles in the thigh wrap around and support your knee joint, and so you want to have that good support. I always tell my patients that the thigh muscles are like the shock absorber for the knees. If you strengthen up your thighs, it'll essentially offload some of that impact from your regular activity, and that can make the symptoms of a meniscus tear a lot better. Anti-inflammatory strategies are going to be important also, especially in the early going, because the meniscus does cause joint inflammation, and that's where pain comes from. That's where sometimes you can get the swelling. And so anti-inflammatory strategies would include diet, keeping an anti-inflammatory type of diet. Medications for inflammation can be very effective for a short period of time, and the two anti-inflammatory types of oral medications would be non-steroid anti-inflammatory medications, and that would be things like Advil, Aleve, Motrin. Other anti-inflammatory medications that are much more potent are going to be steroid medications such as prednisone or methylprednisolone. So those are oral medications that are very effective in reducing inflammation, but those medications, especially steroids, have a lot of really undesirable side effects, and they really should not be taken for a long period of time. Regenerative therapies such as platelet-rich plasma can be very effective to heal a torn meniscus if the meniscus pattern is a good one, located in an area where there's adequate blood flow and not associated with mechanical symptoms. So not a big flap, not a bucket handle tear, but if it's a smaller tear in the right spot, then things like platelet-rich plasma can actually heal the tear. And at minimum, even if it is a larger tear, the PRP can reduce the inflammation and reduce the pain in your knee for a period of time. Degenerative tears also are non-surgical if they're associated with significant arthritis. And so when you have really bad bone-on-bone arthritis, your meniscus will always be torn in that situation because it just kind of gets ground up in between the bone-on-bone. That is not a tear that you want to have a surgery for specific for the tear, because you're still going to have the bone-on-bone arthritis, and patients that go in for surgery for a meniscus tear that have really bad arthritis do not do great after that surgery. When do you need surgery, and what is the surgery for a meniscus tear? First off, when you need the surgery, if you're having those mechanical symptoms, if your knee is locking, if you have that bucket handle tear that you've been diagnosed by an MRI scan and you're not able to like fully straighten out your knee, or if you've had persistent pain for 6 or 8 weeks and you've been trying all the non-surgical stuff we talked about and you're just not improving much, then that would be a sign that you need to have the surgery for a meniscus. Athletes that have meniscus tears, especially younger ones that don't have a lot of arthritis in their knee, those we're usually a little bit more aggressive on getting to surgery faster, especially if they happen to be in a season and they need to get back to their sport. The surgery for a meniscus tear is what we call arthroscopic. So this is a minimally invasive procedure that involves little poke holes, a few millimeters wide. Usually there's just 2. Sometimes you can do 3 or 4 depending on the significance of the tear and what all is being done. But that procedure typically will take anywhere from 20 to 60 minutes. It is an outpatient procedure, so you will go home after the surgery is done, and the recovery really depends on what kind of surgery that you have. And there are 2 main types of treatments for meniscus tears surgically. And the first one is a trim, what we call a partial meniscectomy. So if you have a portion of that meniscus that's torn and there's a large flap, for instance, then we just remove that flap and leave all the healthy meniscus tissue behind. And that is especially important if the tear is located where there's not good blood flow, and we will not expect a good outcome if we try and do a repair. So for degenerative type tears, or for tears that are large or located in areas where the blood flow is not good, the treatment is trim the torn stuff, leave all the healthy meniscus tissue behind. It's a very fast recovery if that is the case, because you can start weight bearing as tolerated. You take it easy generally for a few days to get the swelling down, and then you're typically back to full activity probably 10 to 14 days after the surgery, and then total pain relief happens within a few weeks after that procedure. The second treatment surgically for meniscus tear is a meniscus repair, and that means that we're taking sutures and we're sewing the tear back together again. Not all tears are able to be repaired, but if the tear is located in an area with really good blood flow, we make the effort to go ahead and repair that meniscus. That surgery generally will take a little bit longer, and then after the procedure, you're going to have restrictions to make sure that you don't break the stitches until the healing is complete. And your healing time after meniscus repair is usually going to be several months, anywhere between 3 and 6 months typically, until you're back to like full impact sports and a full recovery. The important thing, whether we're doing a repair or whether we're doing a partial meniscectomy, what we're trying to do is save as much of the meniscus as you can, because the meniscus is a shock absorber. It does protect your knee joint, and when you lose a lot of your meniscus, what happens is the bones, the tibia and the femur bone, start to hit each other a little bit harder, and the cartilage on the ends of the bones will start to break down, and that can be a cause of arthritis down the road if you end up losing a lot of your meniscus. Always we make an effort to try and keep that meniscus preserved as much as possible. So what not to do when you have a meniscus tear? First off, don't ignore locking or catching. You know, a lot of times patients will come in after seeing me, or they'll come and see me after they've had symptoms for weeks or potentially months, and pretty significant symptoms, and I'm always like, what took you so long to get in here? And a lot of times people are like, well, I just thought maybe it would get better. If you're not getting any better, it's been a few weeks and your knee is really causing you some problems, don't wait, get it checked out, figure out if this is a problem or not, and then you can get on the right track as far as the treatment plan goes. Another thing not to do, don't rush surgery because of an MRI report or an MRI diagnosis of a meniscus tear. Not all meniscus tears need surgery. Degenerative tears don't need surgery. Smaller tears aren't going to need any surgery. So a lot of times people come in with their MRI scans and they're like, I have this tear, I'm over here to get my knee arthroscopy surgery, and they don't see the next line that says they're bone-on-bone arthritis, in which case a knee arthroscopy is not going to help them at all. So there are definitely situations where meniscus tears are non-surgical, and so if you get the MRI report, it says you have a meniscus tear, do not rush into thinking that you need a surgery. The last thing is, don't continue with aggravating activity like impact or deep knee bending with twisting. Those are the motions that are going to aggravate a meniscus tear. If you can do activity that does not involve that, then your knee is going to be much happier. And so that's what not to do, is to keep aggravating your knee with impact exercise or like twisting or deep knee bending. So I am Dr. Brad Homan. I hope you are loaded up with all sorts of knee knowledge and you have an idea of when you should get that meniscus tear checked out by a doctor and when you've got this under control. So if you found this video interesting or you thought the information was good, please like, subscribe, and you can hit the bell for notifications. I will be bringing out other videos. I'm going to have a lot more content coming out. It'll be very useful for you, especially if you're very active or have orthopedic issues. So in the meantime, take care of your knee so it can take care of you.